With a track record spanning over 8 decades, Premier Service Medical Aid Society today stands as not only Zimbabwe's largest medical aid society, but one of the biggest on the African continent. Founded in 1930 by members of the Public Service Association as an in-house medical aid fund, Premier Service Medical Aid Society has evolved over the years from its initial focus on public servants to cater for members in the private sector, non-governmental organizations and individuals. PSMAS boasts of the most comprehensive range of medical aid products available on the Zimbabwean market and extending beyond the traditional medical aid funding to healthcare service provision through a network of healthcare facilities under its subsidiary Premier Service Medical Investments, PSMI. Through PSMI, the following facilities are available: medical clinics and hospitals, ambulance services, radiology, pathology, dental services, optometry, pharmaceutical and rehabilitation centers. In addition to such a wide array of services, Premier Service Medical Aid Society has gone where its members are. It has branches in many towns and cities countrywide. Members have access to Premier Service Medical Investments facilities and other healthcare service providers countrywide. Through this representation, PSMAS has maintained its commitment to its members through convenient locations and superior customer service. Indeed, customer service has underpinned the growth and success of the society, with emphasis placed on developing products and services that meet the different requirements of its diverse subscriber base, backed by a personalized approach to attending to customer needs and queries.
We are spread right across the whole country, and our thrust is to now go into the rural areas and set up healthcare facilities in growth points, so that the whole idea is we would like to take service to the people rather than the opposite, where people have got to travel kilometers and kilometers into urban centers to get service.
Premier Service Medical Aid Society has a wide range of products varying in value and worth. Some of the major attributes of these products and PSMAS services include no age restrictions, no health declaration required, drug purchasing facilities, foreign treatment, flexibility, no waiting periods when joining as a company with one's eligibility period. Prudent Fund is a special fund for chronic diseases. The fund covers the cost of drugs for diabetes, hypertension, HIV and AIDS, cancer, asthma, epilepsy, cardiac and renal ailments. These products have been tried and tested on the market and have been hailed by many members for providing life-saving solutions at critical times.
I had a problem with my legs for a long time. And when I visited my general practitioner, he referred me to a neurosurgeon who then sent me for x-rays and for an MRI scan. And when I got back with the scan, with the results, he said, you definitely need a spinal decompression, which is an operation on the spine. And these fees were out of reach. I couldn't afford them. I thought of my medical aid and I approached them for help. And they asked me to compile what is needed for the op. So I had the bill from the neurosurgeon, the bill from the anesthetist, and the bill from the hospital. And I filled in some forms and left it with them. Within a week, the doctor phoned me and said, are you ready for the op? I said, oh, why? Well, the medical aid has paid everything. You can go to Avenues Clinic now, tomorrow, and book yourself in. I went to the Avenues Clinic. I was in a wheelchair. But when I came out, I was walking on my 2 feet. Thanks to the Premier Medical Aid Society for helping me.
Since its humble beginnings, Premier Service Medical Aid Society has consistently grown its membership base. In recent years, following its transformation from a public service-driven membership to an inclusive one, the Society has outgrown competitors, reaching an unparalleled membership of over 500,000. In recognition of its consistent growth and innovation over the years, Premier Service Medical Aid Society has captured a number of prestigious local and international awards. Furthermore, the Society's services continue to be in demand within the region and elsewhere on the continent, falling in line with the group's vision of being the leader in financing quality healthcare home and away.
We got a government tender in Zambia in 2006. So we are operating in Zambia in all the 9 provinces.
PSMAS is also mindful of its duty to plow back into the community. And as such, its corporate social responsibility programs have touched the lives of various worthy and deserving causes, charities, and individuals in Zimbabwe. These include school fees assistance for underprivileged students, furniture for schools, bedding for hospitals, free spectacles and wheelchair donations to those in need.
Premier Service Medical Aid Society has a human face. It has humility, it is sensitive and friendly to its stakeholders and its business colleagues.
Going forward, PSMAS sees greater potential for growth in the Zimbabwean and regional markets and is positioning itself to fully exploit those opportunities. As always, its growth in terms of product development and market expansion will be driven by the need to provide the best possible and most relevant services to its members.
As a nation, we hear people saying our health delivery system is deteriorating. I am happy to say our group is really going flat out on this one.
We look forward to seeing you at any of our offices countrywide, or come meet our dynamic, innovative and friendly marketing team at head office.